Do you know who are the members of your pregnancy care team? This is a question that everyone planning to welcome a new life into the world should be able to answer confidently. Your pregnancy care team is a group of professionals who will be by your side, ensuring your journey to parenthood is as safe and healthy as possible. They are the ones who will guide you, support you, and provide the necessary medical care during your pregnancy and delivery. This team can be as small or as large as you want it to be, depending on your needs and preferences. They could be anyone from an obstetrician or a midwife to a doula or a lactation consultant, and even your own personal support system. But how do you choose the right team for you? This video will help you understand the various choices you have when it comes to choosing your pregnancy care team. The first step in building your care team involves deciding where you want to deliver your baby. Now, there are three main options to consider: a hospital, a birth center, or your own home. Firstly, let's talk about hospitals. They're an excellent choice if you have any health concerns or if your pregnancy is considered high risk. Hospitals are equipped to handle complex births, provide special care, and manage emergencies. They also offer a variety of options for pain management, but remember, a hospital birth may not offer the same level of personalization or comfort as other options. Next, we have birth centers. These are a great option if you're planning to have a baby without drugs or medical interventions, commonly known as a natural birth. Birth centers provide a more homely, intimate environment than hospitals, but with some medical support available. But bear in mind, if complications arise, you and your baby may need to be transferred to a hospital. So if you're healthy and your pregnancy is low risk, a birth center could be a good choice for you. Lastly, there's the option of a home birth. This allows you to deliver in the comfort of your own home, surrounded by familiar settings. You'll need to plan a bit more for a home birth, ensuring you have the necessary support and resources in place. This is also best suited for those with a low-risk pregnancy. So whether you choose a hospital, a birth center, or a home birth, each comes with its own set of advantages and considerations. Your decision should be based on your health, your comfort, and your personal preferences. Remember, this decision is a crucial one. Your choice of delivery location can greatly influence the rest of your pregnancy care team. So, take your time, do your research, and choose the option that feels right for you and your baby. Now that you've thought about where you want to deliver, let's consider who you want to be there with you. The first member of your pregnancy care team is the healthcare provider that you choose for prenatal care and for labor and delivery. The most common options include an obstetrician or OB, a family medicine healthcare provider, and a midwife. An obstetrician is a doctor specializing in prenatal care, labor, and delivery. They're also surgeons and can perform cesarean sections if necessary. OBs usually deliver babies in hospitals, making them an excellent choice if you're at risk for complications during your pregnancy or delivery. Alternatively, you might opt for a family medicine healthcare provider. These primary care physicians also provide prenatal care and OB services. If your primary care provider is a family medicine physician, then you have the option of continuing to see them throughout your pregnancy. Another choice is a midwife. Midwives have specialized training in prenatal care, labor, and delivery. Some midwives are nurses known as certified nurse midwives or CNMs. Midwives can deliver babies in various settings, including hospitals, birth centers, and home settings. They generally care for women with low-risk pregnancies, or they may partner with a physician if the pregnancy has some risk factors. Beyond these primary providers, your pregnancy care team might include additional support roles. For instance, a doula can provide emotional support and advocacy during labor and delivery. Nurses will likely be a part of your care team, especially if you deliver in a hospital or birth center. Childbirth educators can help prepare you for labor, delivery, and the postpartum period. They can offer guidance on everything from breathing techniques to newborn care. Lactation consultants specialize in breastfeeding support. They can assist with everything from initial latching to troubleshooting common breastfeeding concerns. A maternal fetal medicine specialist might be part of your team if you have a high-risk pregnancy. These providers specialize in the care of patients with complicated or high-risk pregnancies. And of course, your personal support system, such as your partner, family, or friends, are an invaluable part of your pregnancy care team. They can provide emotional support, practical help, and companionship throughout your pregnancy and beyond. Remember, your pregnancy care team can be as unique as you are. There's a vast array of professionals available to support you throughout your pregnancy journey. The key is to select a team that aligns with your personal preferences, health needs, and birthing plan. In the end, there are no right or wrong choices when it comes to assembling your pregnancy care team. It's about finding what feels right for you and your baby. After all, this is your pregnancy journey, and you get to decide who's on the team that will support you through it. Your pregnancy care team can be as unique as you are. There are no right or wrong choices, only what feels right for you. Choosing the right care provider for your pregnancy is a crucial decision. Here are some things to consider. Firstly, consider your personal comfort and preference. Would you prefer a male or a female healthcare provider? This is a personal choice, and it's important to consider your comfort level, as you'll be sharing intimate details of your health and life with this person. Next, think about your ideal delivery location. Will your chosen healthcare provider be able to deliver your baby where you want to deliver? Your provider's practicing privileges may limit where they can assist with your delivery. Make sure to discuss your preferred birth location with them, be it a hospital, a birth center, or your own home. Thirdly, assess the provider's qualifications, training, and experience. Does your healthcare provider have the necessary training, experience, and certification to take good care of you and your baby? This is a critical factor, as you want to ensure the best care for both you and your little one. Another thing to consider is recommendations. Can your healthcare provider be recommended by other healthcare providers? Positive feedback from their peers can give you confidence in their expertise and care. Let's not forget about availability. Will it be easy to get in touch with your healthcare provider? And who will provide service if they're not available? You want to ensure that you have access to care when you need it, and that there's a competent backup plan in case your provider isn't available. Lastly, consider your financial situation. Will your insurance cover the provider's services? This is an important practical consideration, as costs can quickly add up during pregnancy. Make sure to check your insurance coverage and discuss any potential out-of-pocket expenses with your provider. Remember, the most important thing is that you feel comfortable and confident in your care team. After all, they will be with you every step of the way on your journey to parenthood. Pregnancy is an exciting time, but it can also be full of questions and decisions. As we've discussed, your pregnancy care team is an essential part of this journey. Whether you choose a hospital, birth center, or home birth, it's important to think about the type of experience you want to have. The members of your pregnancy care team could include an obstetrician, a family medicine healthcare provider, or a midwife. Other potential team members might be a doula, nurses, instructors, lactation consultants, maternal fetal medicine specialists, and of course, your personal support system. When choosing your provider, consider factors such as your comfort with their gender, their ability to deliver where you want, their experience and certifications, their recommendations, their availability, and whether your insurance covers their services. Take the time to explore your options, ask questions, and make the choices that are right for you. You've got this. Thank you for tuning into our video. We hope you found it both interesting and informative. Making decisions about your pregnancy care team is an important part of your journey to parenthood. Remember, the choice is yours, and there are many resources available to help you make the best decision for you and your baby. If you found this video helpful, please consider liking it. Your support helps us reach more people who might benefit from this information. If you have friends or family who are expecting, consider sharing this video with them. You never know who might need this information. Don't forget to hit the subscribe button and the notification bell. This will ensure you don't miss out on any of our future content. We regularly upload videos on various topics related to pregnancy, childbirth, and parenting. We aim to provide a supportive and informative space for all expectant parents. Stay tuned for more informative videos. As always, blessings to you.